Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Hello and welcome back to the Sit and Stay podcast, brought to you by RipsyTech. I'm RipsyTech Product Manager Parker Anderson, and as always, I am joined by the magnificent Tom Tarshis. Hey, Tom.
Parker, nice to see you.
I should also mention Tom is the founder and CEO of RipsyTech, which I forgot to mention. He's just some random guy I brought onto the show, actually. Tom, how are you doing today? We're talking more about budgets today. Are you feeling really amped about this topic?
You gotta, when you make a budget and you see that you were kind of close and it lines up and your hard work and over that tediousness pays off, it is very satisfying. I think people who watch us on video will recognize, Parker, that you sort of have an interesting backdrop today and what's going on with where's your cool toys and other fun stuff that's usually in the background?
I recently made a move, purchased my first home, which is a very big, fun, exciting, and, healthfully stressful milestone in life. And my, gosh, did you really think they were toys? Or no, I'm just kidding. So
collectibles. Sorry.
My background, collectibles. There you go. Yes, that's what adults call toys. My background before, I wasn't a big fan of it. I didn't like having kind of too much of my personal interests in the background, and so I set it up so that once I'm done kind of setting up the room that I'm in my new office, there will be some stuff behind me, but the exciting stuff that you're talking about is off to my side, all in one place. I can look at my collectibles and go, wow, yeah, that's excellent. But I didn't want to distract the RipsyTech viewers too much. But if anybody sends an email saying, hey, I really miss the collectibles, then maybe I'll reconsider.
Well, it is kind of part of our fun culture, and so your boss approves. But if you're upping your game as a new homeowner and they're gonna keep a more neutral, psychodynamically less revealing background, I support that.
I'm gonna be honest. I mean, the biggest thing is what to do with all of the Lego that I have accrued over the years. I have my favorite things, and I found places for those, and I do have some ideas for what can go in the background, some of which includes Lego, but when you move, you put a lot of that stuff in a box, and then you kind of unpack a bunch of things, and you pick the ones that you like a lot, and then you look at the rest and you go, you might be okay staying in that box. I don't know if I want to deal with this. In which, I don't know. Well, then you go through the whole thought process of like almost mourning the Lego hobby. It's just it's a fun hobby, but it creates space.
But Parker, you're all good to label that box Lego and put it in storage, because in about 5 or 6 years you will be engaging with your young one, and Legos will be exciting and fun again. So
that's true.
Good.
I mean, Legos are always fun and exciting. I appreciate it. There are two Lego boxes. There's the Lego box, and then there's the unbuilt Lego box, which is just full of all of the boxes of things that never got built. And everything in the built box kind of came apart. So it's really, it'll be a fun process for sure.
Well, and relevant to our budget follow-up, we did just get Parker a company credit card, and when you're moving into that new house, there's a lot of extra trips to the hardware store, furniture store. So just to remind you, Parker, we do track those credit card purchases.
The RipsyTech credit card is hardware store free. I'll put it on the record. My personal credit card cannot say the same. Yeah, I think I went to the hardware store maybe 4 or 5 times so far in the last week.
Gotcha.
Yeah, very fun and illuminating. Yeah, it's one of those things that already thinking about the new projects. That being said, I got to build my own budget for new things in my own home, but that just speaks to how relevant building a budget is as a skill, not just for your own personal finances, but also for your business. So today, last episode we talked about why a budget is important for a mental health practice to have. And today we wanted to actually talk a bit more practically about how to build and then use that budget for your mental health practice. So I think the best place to start would just be giving a quick overview of the key components to a budget, what should go into one, especially for a mental health practice.
Yeah, very good. And well, so Parker, on the most simplified terms of a budget, what are our two budget categories?
Um, Profits and losses.
There you go. Yeah. Revenue and
Yeah,
expenses, right?
yeah.
And so even even getting a spreadsheet out and saying, here's how much I think I'll make and here's how much I think things cost, you could call that a budget. But I think what our goal was this week is to get a little more specific about how to do good estimates of both of those broad categories, which is what the budget is all about, and how to build in safeguards. So, on a basic level, it is revenue and expenses. We'll break them up. Just to reflect in this field and in these group practices, as we've mentioned, we have very low costs of doing a business. So the expenses
Right.
category, especially with telehealth, can be quite low for people, which does cause the problem where then people are less motivated to make that budget because they
Mm.
just see what they earned and what they spent and take the rest as a paycheck. And again, that's fine if you're in a private practice. Not It's not really fine, but you'll survive in a private practice doing that. But if you want to review some of the important things we talked about last week, we really want people to have their budget set. So let's jump to the expenses categories first, and so that we can sort of hit
Mm-hmm.
what goes into the expenses category. And so, Parker, for a business, can you name some costs? What are some of those categories?
Oh gosh, this is fun. Well, I believe there's costs associated with registering your business with the state. Is that correct?
Okay, so good.
Speaking
So
as somebody who's
what,
never actually done that before, I'm kind of taking some shots in the dark.
there's kind of 10, um,
10.
in the world of accounting, and I'm not an accountant, but I'll say in the world of doing budgets, I'd like to have 10 different cost line items. And let me just
Oh,
confirm that
okay.
number is right. I am wrong. I have 14 items. Um,
Goodness.
and so, although four of them are sort of in one category, and one of them is other, which is always helpful to have an other expense category. But what you mentioned, Parker, that would
Right.
fall under the legal and professional costs. It's kind of
Ah, yes.
getting your city business license, registering your state business license. I will say that after working with lots of accountants, there is some subjective piece to deciding what category something may go in. So it's
Well, of
not, some
course.
things are, yeah, sorry, some things are very clear, but then you don't necessarily get in trouble if you categorize something that should be a legal expense under advertising, right? As long as you're consistently always classifying the item the same way for your budget purposes. But okay, so we
Okay,
have
so
legal and professional. Oh,
I'm gonna rattle off. Yeah, sorry. I'll try to rattle off up to 14 things. I'll probably come up with six. So yeah, we have legal. I'm thinking office space. I'm thinking internet. Let's see. I don't know. Technological, maybe. Um, hmm. Gosh, I mean, I feel like legal covers a lot of what I was thinking of. There's got to be something like, I mean, paying your employees, paying
Okay,
yourself. That's a
good.
huge one, right?
Sa-
Um,
Very good.
benefits,
Very
that
good.
might fall into the same thing. Let's see. Hmm. Yeah, I mean, if you're paying for any I mean, I don't know if I said technology already, but like, if you're paying for any kind of service that needs to be accounted for. Um, hmm. All right. What did I miss?
You did pretty well, Parker. Like there that you're gonna like kick yourself over a couple of the things that you missed.
Yeah, I'm sure I will.
So what I like to do, you mentioned salaries and benefits, which this is the number one cost for this industry is that salary benefit cost. We sort of break it down: salaries, benefits, dues, membership, licensing. So if you're paying for your state medical license, things like that, which is, different from like registering your business for the city. And then education and training. Those are sort of all this employee salaries piece that
Mm-hmm.
we keep them sort of separate, but when we're calculating that, we have a model to if your baseline salary is X, this is what it actually costs you to pay an employee. And then you mentioned rent. You mentioned software expense. So we usually put rent and utilities together. These days,
Mm-hmm.
software expense would be like your G Suite, the cost of your EHR. A lot
Right.
of this is a real category for all mental health providers now. We talked about legal and professional, which is sort of your accounting or having a lawyer review something, or a few other initial fees can go under there. There is your office and patient expense, which isn't rent, but is, do you have snacks in your office? Do you need to get some furniture or a
Ah.
printer? Do you need a new computer? That would go under that category. You didn't mention insurance, but that is a big category for any
That's
business
of
owner.
course.
That's
Of
not one I
course.
think you should kick yourself over though, but that would be for your malpractice insurance, your general liability insurance, your workers' comp insurance, any other insurances that you have. There is this category for bank and credit card fees, which, if
Oh, yeah.
you are taking credit card payments, there are sort of two ways to do this. You could do it on the revenue side and subtract from your revenue calculations, or you can do it as a cost, which is what I prefer to do. Although we predict that cost based on the revenue and can talk about that a little bit more. And then the couple that you missed, travel and meals, Parker. And as you know, when
Ah,
you're,
yes, that is true. Yeah, when before you work for an employer, you don't think that that's something that's going to be covered. But then you do, and then it's like, oh, wow, that's great. I appreciate those kinds of things for sure.
that's right. And I think, this could be, if you're just sort of doing a very small group practice, it's likely this is separate from like any sort of education or training benefit and salary costs, but there could be other um, conferences or trainings that go beyond sort of what's covered, but through whatever plan you've set up for paying people. And it
Hmm.
is, or if you're meeting a colleague for lunch, that's going to go under this category. There are some rules about meal deductions
Right,
that your
right.
accountant will talk to you about, but
Yeah, I mean, I remember every time we went to a conference, we were kind of told there was, a certain number of money that would be covered each day to pay for meals. Yeah, then there were certain things to cover travel. But outside of conferences, I remember, about 6 years ago when I was working for your clinics, and there was kind of three located in the Bay Area, and I worked for two of those clinics. So halfway through my day, I would spend 30 minutes driving from San Jose to Menlo Park. And those miles that I did every single day, which I had to go very specifically, I got to go from point A to point B. Those miles were covered.
That's correct. And the general rule is you're not allowed, when you're driving into wherever you're starting your workday, and when you're driving home from wherever you're ending your workday, you're not allowed to get reimbursement or deduct those miles. But any driving you do during the day, that is something that the employer is obligated to pay for. Now, certainly if you're doing your own business, you're not going to get in trouble if you don't pay yourself for driving somewhere. But it is a way for you to get some income that doesn't have taxes taken out of it. And so if you do a reasonable amount of driving, you will want to track that and pay yourself that way to save some tax money. And then the final categories were advertising.
Oh, right.
Which
you had mentioned it before I even started listing things. I should have had that.
And then the other category, but you hit most of them, Parker. So
I'll take it.
Yeah, and then to be more specific, and we what you want to do is figure out your monthly expense for each of these. When you're just starting out a clinic, you also want to plan for, there's a lot of initial expenses between an extra security deposit, extra furniture, and those items are better to be excluded from your budget. That you're going to go in, you need $5,000 in initial purchases to just have things running. You don't need to worry about putting that in the monthly budget tracking. That should be at separate startup costs. But then when all that is taken care of and you get into the rhythm of your work, that's when you can get very good data on what each of those categories costs you. Just as an example for, just to throw some numbers on top of things. So for maybe a clinic with 4 providers who are all part-time, right? Sort of that office and patient expense, most things are just a couple $100. That's maybe a couple $100 for some snacks. Software expense also should be pretty low, especially if you're using RipsyTech, but maybe a couple $100 there. Your rent and utilities, for a 2-bedroom place, it's probably $1,000 to have 2 offices shared with, 4 part-time people. Depending where you live, it could be a little bit more or less. Legal and professional, it's rare that you actually need much with lawyers. If you have an accountant, that could be a couple $100 a month, but that might be a category that's really zero for a lot of people. Repair and maintenance should be very low, especially if you have a good landlord, because you're taking care of, they should be taking care of that piece. Insurance costs, again, only a couple $100 a month. And then travel, meals, advertising, other, those are also all very low, like $100 or $200 a month. So you're sort of looking at, adding up all those numbers, it's really just like a couple $1,000, $2,000 to $3,000. There is that credit card fee, which there's a model where if 25% of your revenue comes from patient fees, you have to look at the model for what percent of your revenue comes in from patient fees. And then you're able to, the credit card companies take about 3%. So you're looking at patient revenue is X percent of your monthly total revenue, and you're going to multiply that by 3%, and then, look at it in response to your total revenue for the month. And so, for example, in our clinic, which does insurance work, but for where 25% of the revenue comes in from patients, we have to write off about 0.9% of our revenue to credit card fees. And we just build that into the budget each month. If you're 100% cash practice, it's just going to be 3% automatically taken out, and it makes that calculation a little bit easier. And then everything else goes to salary and benefits. But compared to like monthly costs of running a business, a couple $1,000, is not much if you think about any other type of business in the country.
Right.
Maybe a private consultant is less, but
Yeah. Okay. So, um, are there things that I can do in my budget to account for seasonal variability?
yeah. So let's, before we jump to the revenue calculation piece a little bit, let's though take a moment on that salaries and benefits piece. This is
Okay.
one that a lot of people don't understand, both as an employee working for somewhere or as an owner. And so, within your salary as an employer, you have to pay your share of Social Security and Medicare taxes, which is an extra 7.65%. There's going to be some state mandated taxes depending on the state you live in. California, we actually have to pay more because we have this good state disability insurance plan. But every state is going to have some different taxes that go in there. And then, do you have a retirement plan, which everyone should, and you should have a
Mm-hmm.
retirement plan with a match,
Mm-hmm.
especially if you're self-employed. It's a way to funnel money in with pre-tax dollars that you can pull out later, and then calculating, educational costs, and then licensing, professional dues, and then benefits, including health insurance, dental, and disability and life insurance. Those are all the pieces that go into that, how much an employee costs. And in a very rough calculation, in general, if someone is making $100,000 a year, you should go ahead and consider an extra, um, you know, 15% of that to go towards the benefits and taxes and actual cost, or maybe a little higher, 20,000. So a $100,000 employee for our businesses actually costs the company about $122,000. And so that is the piece to be aware of the true cost of an employee.
Okay. Yeah, that you wouldn't. I never thought about that before. So, well put. Okay, so is there anything on this kind of branch of topics that you want to cover before we move on to talking about revenue and income?
I think those are the big pieces. The only one other thing to mention is if you have an employee that is not generating revenue, this is another
Oh,
cost
yes.
to your company. So if
Right.
if it's all clinicians and people sort of pitch in doing some of, scheduling their own patients or submitting claims, then you don't have to worry about this extra cost of employees. But a lot of practices, excuse me, do have someone that works part-time or more that doesn't generate revenue. So you want to be sure that their salary is in there and it's part of the budget and the costs for running your clinic.
All right, well put. Okay, so then to you know bounce back to my previous question. So I mean, yeah, when it comes to the money that's coming into the business, how do you plan for seasonal variability in that, some times of the year seem to be more popular than others. And I think, almost every industry, feels this in some type of way. So how would you say this applies to the mental health field?
Yeah, um, great question, right? So now we're jumping over to that revenue estimation piece, which, in reality, that's probably the more important category, because you need to know how much money you're going to be earning. And as you alluded to, Parker, right? If you work with kids, you know that August and the time between, the last 2 weeks of December, you're not going to be seeing as many patients. And so, the first piece before you look at the variability is figuring out how you're going to calculate that revenue generation. And there's two ways to do it in our industry. One is using a time based approach, which if anyone has listened to our podcast, they will know that I am not really a fan of time basing anything because it doesn't give you very granular accuracy. That being said, like if you're a private practice master's level therapist and you always charge $200 an hour, that's pretty straightforward to do your budget with. So $200 an hour, you know that you're seeing 25 patients a week. Your revenue should be $5,000 a week. And then there's, in general, 46 working weeks in a year. That's if you take 4 weeks of vacation and take off 10 holidays throughout the year. So 5,000 a week times 46 weeks gives you 230,000 for revenue generation for that year. I like to actually break things down by how many working days there are each month. So on our budget templates, you can look at each month and say, okay, there's 21 weeks. It's usually, between 19 and 23 working days each month. It's nice to know, though, which months have more weekends and which don't, because that, Parker, also helps answer the question about, is there going to be less revenue because there's 4 less working days just in this month? And especially if you just pay yourself based on what's left in the bank.
Yeah, I think the fall time is the fall time and the winter time, I feel, are like very holiday heavy quarter. Q4 and Q1 are very holiday heavy. So that's good point there.
Yeah, and the reason, the problem with that time-based billing is that you're still not really able to build the 90785 code or some of the other codes that are used for revenue generation when you just do the straight time-based billing. So the other way to do your revenue calculations is through an RVU system and figuring out how much money per RVU does your clinic generate. And there'll be a different dollar amount for each level of provider. So for master's, psychologist, or physician, you'll have 3 different dollar per RVU values. But this really gives you a very fine, accurate measure that once you know what you generate per RVU, even if you're a cash practice or if you take insurance, knowing that number then helps you translate into how many RVUs a day you need to work to generate the salary that you need.
That was something we worked pretty hard on at one point in the system. That's one of my first designs for our system. Get the productivity and tracking and help accurately understanding how many hours does this person work, and therefore how many RVUs would they need to do to kind of it was based on a bonus system at the time, so it was really at what point do they start earning a bonus, and then how high is that bonus based on how much work they did. All very good. So okay, I mean, well, I guess what else would you like to say on the specific topic?
Yeah, and I think, and a little historic, like we used to tell people, we expect you to work 6 hours a day. We don't actually do that anymore. We say this is how many RVUs you're expected to earn on a work day. So if we say you have to generate 50 RVUs, you can do that pretty easily in 6 hours, depending on sort of patient visits, but it removes variability from the budget because we are being very exact about the work requirement that is expected of the employees. And then the other piece that you alluded to was, okay, we know when you have a new employee, you need to figure out how long it takes them to actually get full, because that's not going to happen right away. And you have to decrease the revenue for the 2 to 4 months before they can actually hit that RVU mark. So that's something to be careful of in the budget. And then for your seasonal variability, those are the times where you want to encourage your staff to take vacations when you know it's going to be light. It tends to coincide with, it's different if you're an adult only practice versus a kid based practice with respect to summer and other times of year. The most important thing, though, is once you start tracking and collecting your data, and once you have a full year under your belt where you're looking at what you predicted and what actually happened with your budget, that is how you get the fine level detail that's specific for you and your group and really helps you plan for the future.
Now, what if you're taking insurance payments and you get reimbursed different amounts based on which insurance company is that the patient that you're seeing has?
Yeah, so if you're doing the RVU approach, you're fine because you're going to take a month's worth of data. And in Ripsy, we make it very easy to pull this data. And you'll
That's true.
average together the reimbursement from all the insurance companies you take, and you will get a dollar value that
Uh,
is combined. And this is, we try to highlight knowing your payer mix and knowing, hey, if this is the worst paying insurance company, we need to make sure we only take 10% of people with that insurance. And we're going to prioritize this other insurance that pays double because that is better for revenue and expanding the business. If you're doing the time-based strategy and for your budget and take insurance, you can still do this. You would be averaging, it gets much more complicated though, because you're averaging revenue based on hours people work, and you can still do the average, but it's not going to have the same granularity as the RVU model.
mm, okay,
I hope this is translating. It's a complex topic, and I know we're just
it is a
speaking about
complex
these
topic. What
categories.
Yeah, I mean, I think what's really interesting is, I kind of had my own way of thinking about this, and I have like my own questions that I want to ask. But then as I listen to you talk about it, you're talking about all these things that I'm like, oh, I wouldn't have even known to ask about that because it's, so I just my observation like that for me that this is really insightful because you're talking about this in terms that, um, I wasn't immediately thinking about. Granted, I'm not a business owner, but yeah, I mean, you're really talking about the this is a very like granular, fine comb approach that you're talking about. So I appreciate it.
Yeah, and that,
Um,
I would even say like I feel like the value of this granular approach is so good for making people feel less worried about revenue streams that even something, budgets are done on a monthly basis. And, in my previous large clinic, we paid people every 2 weeks. And that creates a problem because 2 months a year, there's three pay periods then. And so
right.
with the budget, you can handle that. You sort of do this calculation that spreads that money out over the different months, but it hurts your granularity and how precise you can be. So that's why in my new ventures, we always just do get paid twice a month. And it makes it, that is specifically for the reason that it makes the budget easier to put in place. And in reality, I don't think people mind that much being paid twice a month versus every other Friday. Maybe I'm wrong about that, but
Well, you touched on payer mix earlier. I don't know if you saw, we actually got a question in from one of our frequent listeners about payer mix. If you're interested in answering that question right now.
let's do it.
Okay, so this is a question coming from one of our listeners based in Massachusetts. His name is Dr. Bilal Bari. He asked, you all mentioned this briefly on a prior podcast, but I think an episode dedicated to payer mix would be great. So his questions really are, how do you fairly decide when to cap patients from a particular plan? Why not weigh heavily towards those that reimburse well? And does it make sense to take as a wide a mix as possible to limit risks associated with any one specific payer. Any thoughts?
Yeah. Yeah, this would be a great podcast episode. Lots of historical stuff here. You know, so let me just try to give a couple broad, and, you know,
Yeah, we could start
broad,
broad here,
big.
and then maybe we can dedicate a whole episode to it later.
Yeah, I think, as a healthcare provider in a helping field, we all take the burden of trying to help everyone with issues, sometimes to our own suffering with respect to working too many hours, accepting unfair reimbursement, and not having the skills to fight with the insurance companies that are all in the billions of dollars of profits to, like, hey, pay a little more fairly. It shouldn't be on us to lower our salaries or increase our workload. And so the first big piece is fight, fight, fight for proper insurance reimbursement. So then, that being said, there is a is there an ethics piece to saying you're only going to take 10% of patients who are on Medicaid, or you're only going to take 20% of patients on Medicare? I should say very clearly, I do not think this is an ethical issue at all. And this is especially true for new practices, that ensuring the financial viability of your new clinic and that the work is reasonable and appropriate is the top priority. So if you have one insurance that pays double what others do, that it is okay to prioritize bringing in patients from that insurance. On the question of, is it important to take multiple insurances in order to have a diverse pool of patients? Like, even if you have a bad reimbursing payer, having seeing a patient versus not seeing a patient, it is better to have a patient to see. So
Right.
for that reason, and for the reason that the longer you're in network with an insurance, you get a little more, power to fight them. It is reasonable and appropriate to try to get in network with every insurance you can. Once you're in network with an insurance, they will say, are you accepting new patients? And you can easily say you're not. And you don't have to say that's because you're full. You could not be accepting their patients because they pay terribly. And that's fine. And there's no ethical problem with that. Um, and for new entities, or if you're about to expand and hire more people, you do want to have patients to fill the schedule. So that is the main argument for accepting a lower reimbursement rate from an insurance payer, especially if that insurance payer is the primary payer in your region, because that it will, if you're a good clinic and word gets out you accept that insurance, it can sort of give you 100% opportunities to fill your provider schedules. I do think there's a lot of subtopics and granular details of the payer mix, and that would be a fun whole session topic. I know in Ripsy, part of our dashboard design was to have very direct percentages of the current payer mix so people can be aware of this, because it can make
Mm-hmm.
or break clinics. I've definitely seen clinics go under because they accepted too many Medicaid patients or too many patients from a insurance that didn't pay well, and they just couldn't make it work with the budget. And it's another testament that so we sort of every month recalculate our RV, dollar per RVU. And so if you've been around, $40 per RVU, and then the next month hey, well, how come it was only $32? You've got to go back and look at that payer mix and figure those things out. Payer mix is a critical piece to healthy business.
Absolutely. Absolutely. Okay, so um, I guess let's thinking about time here. Let's talk about, what are some common budgeting mistakes that you think should be avoided at all costs?
Yeah, and I think you alluded to this, Parker, and this is with the historically what has been hardest to pull together has been the consistent revenue projections.
Mm,
So people often overestimate, hey, I want to see 25 patients a week. It is actually hard to make that happen each week. So being very careful and thoughtful, and it's that sort of under promise, over deliver. That's what you want to go into your budget. So, for example, if you want to see 25 patients a week, I think in your budget and time and space, you should see, okay, we know that 2 or 3 patients a week are not going to make it for some reason. So I need to build in actually 28 hours and try to schedule 28 patient visits to hit that 25. So for your just my initial budgets, it was sort of like, you know, 25 patients, and then you never, maybe once every 10 weeks everyone shows up. But so you have to take that into account when looking at your patient visits. We used to give people freebie. We used to be more generous if people canceled, or we charged a very nominal no-show fee that was only 10% of the revenue that we would have gotten for the clinic visit. So we changed our no-show policies and fees and make sure people are aware of it. And it is a significant fee. Like, it is okay to be strict and charge the full fee if someone doesn't give you enough time to put a different patient in that spot. So that is a very important budgeting piece. Is there a big, and all of these things sort of come from the revenue projection side. It's unlikely that there's going to be some massive unforeseen expense coming up. The biggest one there is with bringing on new staff and knowing
mm-hmm.
that, especially a lot of mental health professionals are very well paid, 6-figure salaries, even for a master's level. So if you're bringing, so we're very careful now, and we know from patterns that, only expect 1/3 of the revenue the first month, and then maybe 60% the second month, and be very careful in that ramp up phase and make sure that you have the reserves in the bank to handle that initial um, ramp up period to get your schedule full. I think other things we used to be concerned about, like, you know, not getting paid on time, like electronic billing and reimbursement, that has largely gone away.
That's a big one. Oh,
Insurance denials, they still happen and are maddening, but it is not the level it was 15 or 20 years ago. So it's nice that those concerns and things that had to be built into the your revenue are not as pressing. We used to have
hmm.
a bad debt column or line item in the budget. We don't even do it anymore because we recover 99% of the money due to us with good business practices. But there are some businesses that have, a bad debt line that 5% of revenue is is going to be bad debt. So they just wipe out 5%
Is
of
that
what they
kind of like
expect.
a like an accounts receivable report where you're kind of yeah, there's a certain percentage that you're kind of accepting is just maybe not going to get paid.
Correct. Correct. And the,
Mm,
it really, by having an active credit card on file, um, and if you take insurance, you can always get what the insurance owes you. It may not be super timely. The big concerns come with patients with high deductible insurance plans that weren't aware of it is probably the biggest category. If you're a cash practice, people
right.
know they're paying cash. But people don't understand their insurance. Often you think, oh, here's my insurance card. You don't know that you signed up for a plan with a $5,000 deductible. You just took the one that had the least, with,
Right.
deductions from your
Lowest monthly
paycheck.
premium. Oh yeah.
And
Yeah. Well, then I would think that actually on the seasonality topic, that quarter one, like that January through March time would be, I guess, yeah, your biggest time for potentially performing services that you're not going to get reimbursed for.
That is a great point, Parker. I'm so glad you brought that up. Yeah, so when people's insurance changes, which open enrollment, most people their insurance can change January 1st. You will always get patients who insurance changed and now maybe they're out of network and they didn't let you know until you submitted under their old insurance and they said, hey, you're not, and we try to email everyone, hey, has your insurance changed, etc. It never fails that some people change, and yeah, that can be an issue. All that being said, and the comment on seasonality, given our lack of supply of mental health clinicians in the country to meet demand, if you're like a decent provider and you get some marketing out there, you can definitely overpower the sort of seasonality adjustment piece. Um,
Mm,
so, right, it's a supply and demand issue. But
absolutely. Okay. Anything else you want to say before we move on?
no, I mean, I think we, as you know, Parker, for our RipsyTech clients, we have a very fine level budget template and
Mm-hmm.
tutorial that we've put together for people. And I know it's hard just talking about different categories and costs, but it's very fun to actually. Well, okay, well, for me, I'll say, you know, it it it.
Yeah.
If you're an
Go
entrepreneur and
on.
it's your business or your sole proprietorship, like putting together your costs and then seeing numbers pop up and like trying to hit those projections, um, is fun. It's
Right.
helps with your sense of ownership and pride in like running a successful business as well as helping people with mental health issues. So
Yeah. I mean, as humans, I think we like to see numbers go up, especially when it comes to money. But yeah, that just your point. Yeah, it made me think of like almost like you're viewing it like it's a video game or something. And you're watching your stats go up or something like that, and it's like that feeling is satisfying.
correct. Yeah, and when you hit your budget, you know, when you're within 1% of accuracy on predicting your budget, yeah, it's like that was like a killer. That was awesome. Like
Good
that's a
job.
challenge.
Yeah.
How close? How good? How well can we do?
Yeah. Absolutely. All right. This has been one of our beefier episodes, so let's move to the mental health business moment.
Yeah, well, Parker, I just, we got this single case agreement, and it must be a law or something where they have to send things by mail to the clinician and the patient. But I'll say historically for other single case agreements, you get one envelope that lists, here's the CPT codes and how many units you get, and they're all listed there. But then in
Mm-hmm.
quite maddening fashion, one insurance company, I won't name them, they sent 10 different letters, each with one of the CPT codes. So as I was opening the 10 of these envelopes and pulling out all this paper and the little language translate, I was like, what? Seriously, like 20, 25. I get if you still have to mail something, but could you really have just put it on one piece of paper instead of 10 different envelopes? And what a waste of paper resources. And I was agitated opening those letters, Parker. It was not fun. I said,
I
yeah,
Are all those letters going to the patient too?
they are. Copy to me and copy to the patient. So
Oh
they will
my
have
gosh.
10 letters from their insurance company, which in general, you sort of get nervous when there's a letter from your insurance company in the mailbox. So I,
Yeah,
I hope
yeah, yeah,
they'll
yeah.
okay.
I my cynical side doesn't usually come out, but my cynical side is telling me that, it could be a strategy to confuse the patient and, just make the whole thing more cumbersome so that they can just, so that the insurance policy holder just has less of a grasp on the whole thing so that they can get more just money squeezed out of them or something. I would hope not, but I would hope that it's just the insurance company is inefficient and not some evil scheme, but who knows?
Who knows?
I would hope that, we just wouldn't be wasting so much paper. All right. Well, this has been a fun episode. Anything else you'd like to say, Tom, before I wrap it up?
No, yeah, always lots of good stuff to talk about. If people have questions or different ways that they do their budget or styles, we'd love to hear about it. As with everything, there is more than one right way to do things.
Correct.
So we always want to stay humble and hear what other people do.
Yeah, please. Yeah. Type it in the comments if you're listening on YouTube. And maybe we'll talk about it in a future episode. All right. Well, that's it for this week's episode of the Sit and Stay podcast brought to you by RipsyTech. If you enjoyed the episode, we would love a rating or review wherever you are listening. And if you'd like to get in touch, you can always email us at sitandstay@ripsytech.com. All right, Tom, I'll see you next time.
Thanks, Parker.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.